Hello, and welcome to MedNews Week, the rising leader in global medical education.
Hello, I'm Gayatri Menon.
And I am Muskan Joshi.
Welcome to MedNews Week conference, where we feature presentations by medicine's global leaders. Today, we have an amazing keynote speaker in Dr. Ariela Marshall. Dr. Marshall is a Harvard-trained hematologist currently working at the University of Minnesota.
In today's presentation, Dr. Marshall discusses the importance of wellness amongst healthcare professionals.
Did you know that Dr. Marshall is an internationally renowned leader, physician, and career development advisor? She is the co-chair of the Women in Hematology Working Group at the American Society of Hematology. She is also the Chief Innovation Officer at Women in Medicine and the Curriculum Chair at IGNITEMed, which are both non-profit organizations dedicated to promoting career development for women in medicine. Dr. Marshall also participates in multiple national advocacy initiatives with the American Medical Women's Association and speaks regularly on a national and international scope to discuss her efforts to advance fertility and infertility awareness, reproductive health and rights, and gender equity.
She truly is a dedicated advocate in her field.
So let's tune in and learn from this global leader.
Hello, and welcome to MedNews Week Keynote Conference, where our goal is to bring you the most cutting-edge information from medicine's global leaders. I am Helena Coloma, and I will be your host today. Before we begin, I want to first acknowledge the great team that helps to make these events a reality. Our founders are two internationally recognized researchers, Drs. Jan Leifman and Chandler Park, who is also the president of Kentucky American Society of Clinical Oncology. Our chairs include Drs. Park and Leifman. Our associate directors include myself, Madhuri Balasubramanian, Muskan Joshi, and Gayatri Menon. Our managers include Alexandra Van de Kieft, William Wilkerson, and Ahmad Aziz. Our educational committee includes Rabab Abbas, Gabrielle Alves, Blaise Bowers, Harshal Choria, Viviana Cortiana, Jenna Gazal, Sean Jakowicz, Shrivika Kanan, Dr. Diksha Mahendra, Sumia Nadar, Sukhmani Sidhu, Harshita Valapeni, and Ahmad bin Zahid. We also want to thank our partners, VUMEDI, a global in medical video educational content, and the National Society of High School Scholars, an honor society founded by Cost Nobel of the Nobel Prize family. Now, to introduce our keynote speaker, Dr. Ariela Marshall. Dr. Marshall is a consultant hematologist of the Division of Hematology, Oncology, and Transplantation, and the director of the Promotions Committee of the Center for Women in Medicine and Science at the University. Internationally recognized leader, physician, and researcher in oncology and wellness for healthcare professionals. She currently serves in various leadership positions, including leadership, empowerment, and develop for women in Hematology Oncology Conference Advisory Board. She is a recipient of numerous grant funding, such as from the Mayo Clinic. She is a globally invited speaker who has given over 70 clinical educational sessions and career development, and she is a passionate and dedicated mentor who has trained multiple mentees in all stages of training. Dr. Marshall has truly done it all. With that, it is my pleasure to welcome her. The floor is yours.
Thank you so much for the kind invitation. I'm really thrilled to be part of your organization and be able to give this talk. So this is a little bit of an unusual talk perhaps, so it's not really focused on a given clinical topic, but instead something I'm incredibly passionate about, which is wellness for healthcare providers with a focus on women in medicine. So I will share my slide, and here we go. So I will start with an overall outline of what is wellness and a wellness journey, kind of my own definition. We'll talk about some barriers to wellness for women healthcare professionals, and then some of the unfortunate consequences of what unwellness can lead to in medicine. And then on a more upbeat topic, we'll talk about how can we overcome those threats to wellness. So I'm going to start by talking about my personal wellness journey. I'll give some of the highlights here and then fill in as we go. So in 2015 over here on the left, that was my wedding to my wonderful husband, who's also a physician. Very happy, as you can see, everyone involved. I think that was one of the peak moments of wellness for me, both personally as well as professionally. I had just finished up my Hematology Oncology fellowship. I had a new staff position at the Mayo Clinic. I was just kind of really thrilled about where things were going. A couple years later, as we decided to expand our family, I realized that I suffered from infertility, which is something we don't talk a lot about as women in medicine, but actually affects up to 1 in 4 female physicians. Very common, but very kind of under discussed and really a detriment to wellness. And then with the help of assisted reproductive technology, I was very blessed to expand our family. But in the picture over here on the right, well, you can see my newborn son is here. I definitely don't look well, in my opinion. I had severe postpartum preeclampsia and really my own physical and emotional challenges that I'll talk a little bit more about. There's also a lot of things that I can't show visually. While I had that admission for postpartum preeclampsia, I was on a magnesium drip, as we use to treat preeclampsia. And I decided that because I was just sitting in the hospital not doing too much, that I should attend all of the meetings that I was scheduled and were on my calendar, even though I was on maternity leave and in the hospital. And my colleagues, were genuinely wishing me well, when they said, wow, thank you so much. That's amazing that you showed up. But I think that it speaks a lot to the culture of medicine that we get praised for attending and career obligations when we're clearly physically and emotionally unwell. It was also a very trying time because my husband and myself and our newborn son were hundreds of miles from family support. It was the beginning of COVID and, just feeling really alone. And in that milieu over the next few months, I tried my best to balance those competing obligations of motherhood and being a physician. I decided to go out for a leadership position, but was asked, are you sure that this is what you want to do? You're a new mom. Shouldn't you focus on that? I gave up a lot of obligations I had otherwise, previously participated in. I saw a sharp decline in my academic productivity. All this led to what I would humbly term as kind of a personal existential crisis of what am I doing? How can I balance all this and still stay well? And that's what led me a lot to my passion for trying to improve the wellness of my fellow women in medicine. So wellness overall, there's not a perfect definition for it. I think, the best conceptualization is your overall health, and that's not just your physical health, it's also mental health. And other things like financial health, social health, we know that close social connections are very important for our overall wellness, including our physical wellness and emotional wellness, but we don't talk about that a lot either. So it's kind of a multi-dimensional aspect here to what wellness really is. And then personally, I think that the way to conceptualize it for me has been life satisfaction. And again, it's very multifactorial. So there's the satisfaction with your job and your career, satisfaction with relationships, personal and professional, satisfaction with your growth and trajectory, and then satisfaction with oneself as a person. Other terminology that you might hear during this talk, so well-being, we really use it as a synonym for wellness. There's burnout, which is along the same spectrum as wellness, although not exactly the same thing. So burnout is an occupational syndrome. So it's chronic workplace stress that we're not able to manage successfully, leading to a few kind of outcomes that are defined in the literature as emotional exhaustion, depersonalization, and reduced professional efficacy. And then there's work-life integration, or kind of the lay term being work-life balance, but I think in the literature we have started to describe it more as work-life integration, because it's never work versus life. Work is part of your life, and you have to find out how to integrate these different aspects of life, including your career and your personal life. So how do you integrate the work and the non-work components of life? So there's a lot of barriers to wellness. Certainly this is true for all physicians the data I'll show focuses on women because there really haven't been a lot of studies particularly focused on men in medicine. I would say some of these are unique challenges for women and some of them are for all physicians. So there's bias, implicit and explicit bias, slower career development, fewer leadership opportunities, lower pay, financial compensation for what we do, unequal domestic labor, there's a stereotype that falls on mothers, there's a mental load, and then even culminating in sexual harassment and assault. And I'm going to show some of the evidence from the literature about many of these things. So gender bias, this is an example, again, from my personal history. So all of these are quotes that I actually heard during different times of my training. So in medical school, many comments, as I'm sure some of our listeners can relate to, from patients, from colleagues, just about physical appearance. During residency, the same thing, also getting mistaken for a nurse all the time. And then even as a faculty member, so as the attending who's supposed to be leading a team, I've had patients clearly call me by my first name and call the rest of my team were male trainees doctor. And so all of these things, comments about what you look like, how you're dressed, are really things that affect women much more than men. Slower career development. So in academics, grant funding is a big aspect of moving forward in one's career, and women have a lower likelihood of receiving grant funding and a lower dollar amount granted. Unequal representation on journal editorial boards, fewer speaking opportunities, and a big lack of mentorship and sponsorship. And these are all key components of one's career development as a physician, especially in academics. Letters of recommendation, which are really important for moving from one stage of training to another and then moving up in faculty rank. Women are commonly referenced to in association with teaching, and men are referenced to in association with research. And these are both clearly essential components of an academic career, but still promotions committees give much more credence to accomplishments in research. And until that changes, this terminology that's used for women as opposed to men really puts a damper on women's moving forward with their work and their career development. Women are often described as these communal terms. So somebody who's really trying to write a good letter, but uses terms such as considerate and caring and warm, that's a great comment on somebody's personal characteristics, but it's really not a comment on their abilities as a professional. And that's what we're looking for when people are trying to move up in rank. So men are the ones who are described by their abilities, such as adept, brilliant, and capable. And of course, this is going to help them move up much more quickly than women. Lacks of leadership opportunities. This graph is referred to as the leaky pipeline. So, as of current, there's actually equal numbers of women and men in medical school, but by the time you make it up to division chiefs and full professors, it's only about 25%, and then department chairs and deans less than 20%. And this is data from 2018, but unfortunately has not changed much over the last couple of years. Lower pay. So a lot of characterization of this has been by people making criticism that, oh, well, men just choose the specialties like neurosurgery that pay more, and women choose specialties like family medicine that pay less. But if you take this data and actually correct for specialty as well as academic ranked and hours worked, you actually still come up with a gender pay gap of about $20,000 to $30,000 a year. And when you account for that over the course of a lifetime, that can be hundreds of thousands, if not millions of dollars. And so this is a very important topic that needs to be corrected. There's an unequal division of domestic labor. So women physicians, even when married to male physicians, tend to spend more time at home doing these domestic activities, and especially after the birth of a child. Everybody does more work after the birth of a child, but women proportionally do more. And it's not just childcare, it's also elder care. So when one's parents need help, women often take kind of the majority of the burden of this as well. There's maternal discrimination and stereotype threat. So a large study of thousands of participants done in an online platform showed that women often reported being disrespected, discriminated against, held to a higher standards of performance, and not being included in decision-making about their own careers. Now, this study has not been done in men once they become fathers, so we don't have the data to compare to, but there's certainly, clearly a maternal stereotype, threat, and discrimination going on. There's also a mental load on women. Now, this is kind of an off-the-cuff commentary based on graphics here, but I'm sure that many of the women in the audience can relate to these feelings of, it's not just my work that I have to do in terms of signing patient notes and writing grants and doing all of these career-related things. It's also all of the things that are needed to run the household and just keep things going on a day-to-day basis that often pops into our mind. And from the women and the men I've talked to, men often just don't experience this type of stress. Not that they're not willing to help, but it's just that these types of repetitive and time-consuming thoughts just don't occur as often. And then finally, sexual harassment, and it's a very serious problem in medicine. I won't go through all of the data here, but suffice it to say that sexual harassment and sexual assault are incredibly common for women in medicine, much more so than men in medicine, and very tragically associated with lower mental health, lower job satisfaction, reduced sense of safety at work, and actually, unfortunately, some suicide attempts have been associated with such experiences. So very, very huge problem that really needs to be addressed and corrected as soon as possible. So this is a lot of bad sounding data, and unfortunately, I will present a bit more of negative data of what can this do. So all of these things, lower career advancement, lower pay, work-life imbalance, really lead to burnout. And again, that's emotional exhaustion, depersonalization, and reduced professional efficacy at work. And there's many, many studies, we've just captured a couple here, but many, many studies that show that female physicians have burnout at much higher rates than men. And also poor work-life integration. So it's not the exact same thing as burnout. While it's closely linked, of course, those who are burned out have worse work-life integration, but they're not the exact same thing. So the practice setting can actually have a big play in somebody's burnout, whereas work-life integration really seems to be more correlated with gender. So again, a big thing, probably due to all of the factors that I just presented. Unfortunately, excuse me, down the line, this actually leads to job attrition and reduced retention in the medical workforce. So looking at this graph, after completing residency, women physicians are much more likely to either partially or fully exit the workforce. So within the few years, like 5 to 6 years after graduating, you can see there's a sharp drop-off in women's participation in the workforce, whereas there's almost 100% retention of male physicians. And this is really a huge problem in an era where we keep quoting statistics that the United States is going to experience a serious physician workforce shortage. So this is a lot of negative data that I presented, but I want to actually now put some positive data out there and show you what we're trying to do to improve wellness in medicine, particularly for women. So there's a lot of interventions that can be made. Some of these are individual, but a lot of them are systemic. So on an individual basis, we can help women by providing career development programs, by helping them find mentors and sponsors, by asking them to say no to things that are not going to help with career development. But really, it's a systemic fix that matters the most. So there are national and institutional initiatives I will talk about. Pay equity is a huge one, a zero tolerance policy for sexual harassment. And then I will talk about some ways that we can rethink promotions and career advancement, and it really all comes down to flexibility and a sense of autonomy and control over one's personal and professional life. So early education. I will make a comment that this is an initiative I am personally involved in. So I guess a quote unquote conflict of interest is that IGNITEMed is a nonprofit organization dedicated to teaching women medical students, any medical student who identifies as a woman, the untaught curriculum of specific concepts for women in medicine that are not part of a traditional medical school curriculum. So these are everything from finances to gender bias to burnout to mental health and personal planning, mentorship. So these are all things that are essential to one's career development and wellness, but are not part of a traditional curriculum. So early education for female medical students. There are a lot of career development programs. I was just a few days ago at the Women in Medicine Summit, an amazing conference that features speakers from all across the United States talking about topics specifically focused on women in medicine. There's career advancement Harvard course that takes place in November every year. There's ELAM, executive leadership in academic medicine. So many, many programs designed to help women move forward in their careers. I think a lot of time and effort as women is spent on, essentially tasks that are not helping move forward in one's career. And so I talk to a lot about my mentees about saying no. So saying no to things that are very high effort and very low impact on one's careers. This is my personal matrix, but I encourage everyone to build their own matrix of what is the effort that is required versus how much impact is something going to have on someone's career development, and really trying to prioritize, the golden ones are those that are low effort and high impact on one's career. Those are things like meeting regularly with mentors, giving a lecture. Things that are high effort and low impact are things that one needs to avoid. And then things that are kind of in the corners, the upper right and the lower left corners, the high effort, high impact, low effort, low impact, those are ones to use sparingly, perhaps with the guidance of a mentor. Everyone's matrix is going to look different, but I think it's really important whenever an opportunity comes up, to really consider what's the impact this is going to have versus how much time and effort do I need to put in. Focusing on passion. So I love this quote that says, the antidote to exhaustion is not rest. So often when we feel tired and burnt out and exhausted, we say, oh, I need to take a step back. I need to give myself some rest. And while that can certainly be the case, especially for physical exhaustion, yes, absolutely. If you're physically exhausted, you need to just sleep and take a rest. But if you're emotionally exhausted, the answer is not necessarily to pull back from obligations. It's to say no to the ones that aren't feeding your passion and to go wholeheartedly into the areas that actually are contributing to what you're passionate about. And I'll talk a little bit about that at the end when I kind of sum up my wellness trajectory. And lastly, sometimes a job is just a job. So again, David White. So a vocation calls out beyond ourselves. It's what humbles, simplifies, and enlightens us about the core nature of the work that entices us in the first place. And he's talking about vocation here. And I think many of us in medicine consider it a vocation or a career or a calling. But sometimes when you're really struggling with the work-life balance, it's okay to see medicine as just a job, something that you are doing, that you are good at, you're well trained to do, you're going to take care of your patients, and you're going to make a decent paycheck. But if you need to take a step back for a couple of weeks, a couple of months, and say, I'm going in and I'm going home at the end of the day, I'm not going to work outside that, I don't feel particularly passionate about this time in my life as a physician, that is okay. I want everybody to give themselves the permission to feel like that once in a while. Now, if you feel like that all of the time, that's a wake-up call that perhaps something needs to change in your career. And lastly, all of this sums up to we really need systemic fixes, not individual fixes. So some of the things that are being done at the systemic level, so many national initiatives such as She Leads, the Her Time Is Now, all of these initiatives are really focusing on fixing a system that has been unequal to women in the past. Institutional initiatives. So this is a picture from what I saw on the wall in a well-known hospital in Boston when I was a medical student. Essentially, it's all older white men. And so that is not very inspiring when you're a woman or a person of color or somebody who doesn't look like an older white man who's striving to succeed in medicine and looks up and sees that essentially what is being modeled as success is old white men. And so there was a very controversial time when these pictures were actually removed. And, I think it's not out of disrespect for these giants of medicine. And the pictures were placed in other areas of the hospital. But I think it's a balance between saying, yes, these are people who've had a big part in the history of medicine. But now, when our medical student workforce looks significantly different, we also have to have, people in focus that they can look up to that look like them, that are going to be mentors and models for them. Support for work-life integration. So it's all about flexibility. We have terrible maternal leave. We have terrible paternity leave. So we really have poor family leave structure in the country right now, and that needs to change so that everyone can feel that having a family, even as a trainee, is something possible and welcomed. And personal pet peeve of mine, Zoom meeting. So suddenly, because we feel that, it's on a computer instead of in the office, it's okay to schedule a Zoom meeting at 7 a.m. or 6 p.m. Well, that stretches the boundaries of the workday more than what's possible for somebody to really have good work-life balance. So I encourage all organizations and groups to have all of their meetings within work hours. If it's important enough that you need a meeting for it, it's important enough to take the work time to do it. Leave people to have their family time for themselves. I love this time banking system that's used at Stanford, where physicians who work additional shifts or participate on committees, and this is unpaid work that most of us at most institutions are doing, but here you can accumulate credits for that and apply it towards things like career support. So getting coaching, getting things that help with domestic tasks like house cleaning or dry cleaning. Hey, wait a second, this hour that I spent on a committee, I can bank that time and actually get some financial assistance for cleaning my house. Excellent. So I love this time banking system. And then strategies to support re-entry after time off. So not everyone works full-time all the time. Sometimes people need to take medical leave, they need to take personal leave, they need to go down to part-time. So helping somebody kind of make these shifts in their career over time as the rest of their lives shifts with them is really important. And then promotion and career advancement in academics, it's all about how many publications and how many grants do you have. So some of us have a different view on what we think are our passion projects. So for me, it's advocacy work. It's advocating for gender equity. It's mentoring and supporting the future women in medicine. And so that, fulfills me kind of in a professional standpoint, but it doesn't always show up on the CV as something that's promotable. And I do think we need to rethink these criteria for how to capture excellence in things like advocacy and community involvement and mentorship. Social media, as you mentioned, with your organization has been an excellent tool for expansion. So I really think of it as a tool for career advancement. It can go on people's own schedules, it can accommodate specific topic areas, and it's a new format for education and networking. And so a few words on my own personal wellness journey. So as I said, at the beginning, we had our baby in 2020 in the middle of COVID and felt very isolated geographically because our families are on the other side of the country. And so in 2021, over on the left here, we moved back to the East Coast, to the Philadelphia area. And for a couple of years, that was fantastic. But my husband was actually feeling very unwell in his work that he was doing. He took a non-clinical job and realized that he very much missed clinical medicine. And so it was very important for him to get back into the clinical and the academic world. And so we started looking for opportunities. And one of the big things was the travel that he was doing in the work that he was doing. And in the middle of the picture here, this was Valentine's Day. As you can see, there's one slice of cake and one beverage. That was me sitting on my own on Valentine's Day because my husband was traveling for work. And so this was just having a really big toll on our family. And so we decided to actually move back to the Midwest. We were very happy about our decision. But during the midst of that move, my husband found a fantastic job at the institution we had previously been at. But unfortunately, it turned out there was not a job for me. I interviewed for a couple of positions, and it turned out there wasn't a position for me at the institution. And so that led to a whole bunch of personal and professional strife and feelings of imposter syndromes and wondering, what is my worth if I can't get a job? So I had this second existential crisis and a lot of soul searching because I was wondering, how can I find this professional fulfillment and, do the work that I want to do as a hematologist, but also be here to support my family and our young son. And I, on a whim, reached out to an institution that is now my place of work. It's about 90 miles away. And I said, listen, I'd really love to work with your amazing group, but I can only work part-time because this commute is just not possible as a full-time physician. And I didn't think that they would go for it, but they actually did. And they were incredibly welcoming and so kind to make things work out for me. And I'm so thankful to the University of Minnesota for doing that for me. And what that allows me to do is to work part-time in a job that I like clinically, and then use the rest of my time to actually participate in advocacy for women in medicine and for women's health and rights in general. And so I'm so thrilled to have found this unexpected new balance in my career. And I actually decided to write about that. And I published this in JAMA about a month ago. And I've had so many responses from people saying just, thank you for speaking this truth about this hard decision that you made. I've gone through the same thing, or I'm thinking about going through the same thing. And I think it's so important to share our stories and share our wellness journeys, because there are so many people out there that are struggling and need that support of knowing that someone else has gone through similar struggles. And to anyone who is struggling with their wellness as a physician in whatever domain it might be, I just want you to know that you're not alone. So in conclusion, I think wellness is a very personal topic. It does overlap with the concept of balance. And at different times in our lives and throughout our careers, there may be different directions and different ways that our career goes. And no one can define our own wellness. It's our own personal definition. But I also believe that no one's going to promote our wellness except for us. So we have to take ownership of what it means to be well and use that in what we describe ourselves at and what jobs we look for and what things we look for outside of medicine. We have to take control of our own wellness journey. And so with that, I will wrap up and thank you once again for this incredible opportunity to talk with you.
Thank you very much, Dr. Marshall, for the really awesome presentation. It's so important, especially given everyone here today. We're all women, and so you're just, truly an inspiration. Thank you very much for the really awesome talk and sharing your own personal journey as well, too. That takes a lot of courage. We are going to be transitioning over into our Q&A. So I wanted to give the floor if Madhuri or Muskan had a question they'd like to ask first. If not, I'm more than happy to go first, but Jenna will be asking our last question.
Thank you so much, Dr. Marshall. And honestly, just hearing about your experiences in this industry and getting a different viewpoint was really interesting, because wellness is such a huge thing right now that we all need. And I truly agree with a lot of things that you said, and getting that balance is very important. For my question, you spoke a little bit about your experience with imposter syndrome. And that is something I have personally experienced and still do sometimes when I do different activities and things as well. Can you tell me how, you were able to manage into it, provide some insight on how you're able to overcome that situation? Because it's something that's so prevalent among women in medicine, especially, and it really puts a huge impact on mental health. So how can we just manage it overall?
Absolutely. And, I'm 10 years into my career in practice and still suffer from it. So I'm definitely not, don't have all the answers. I think for me, what's really important is having multiple domains. So if you have only one domain in your life and you feel like you're not doing well at it, then you feel like you're not doing well in your life. I think for me, that's the importance of having an academic career, which involves clinical work, mentors, mentees, the advocacy work I do for women in medicine and for women's health, my family, my good friends. So I think when you experience failure in one domain, you don't feel like you're failing in all domains. So I felt, when I was not getting the job that I was looking for at the institution that I wanted to, that, I'm a failure clinically. But at least, I had all these other dimensions that, I talked to friends, I talked to mentors and mentees, and everyone said, this is one setback for you, yes, but it doesn't mean that you're not good in X, Y, and Z else in your life. And so I think it's really important to have those other pursuits outside medicine, or at least outside kind of one aspect of your job in medicine. So when things just nothing is ever going to go well for everything, but the more things you have, the higher the chances are that when one thing is not going well, there will be other things in your life that are.
Thank you so much. And, that's kind of really important because it's not just one single thing. It can be different things and different aspects that'll, shape you and change you as well. So thank you so much for that.
Hi there, Dr. Marshall. So first of all, I would like to truly thank you for that amazing presentation. As a female, as someone who's been so passionate about medicine since I was pretty young, I see the struggles that women face. I've seen women leave their have degrees, have MDs, but leave their careers completely to focus on various different things. And although I don't shame them for it, I see how the society and the expectations really do affect us. So your presentation about wellness and women in medicine, truly it really got to me, and you're truly inspiring, and for everything you've done, and I truly appreciate everything you told. So my question to you today is: so I'm still pretty early in my career. I'm still just a med student right now, but the stress of boards and studying for university exams and research and extracurriculars really does get to me. So what tips do you have for someone in my stage of career, just pretty early on? What tips do you perhaps have to maintain wellness? Because this is a pretty demanding job. And if we are going to be burnt out this early on in our careers, I don't know how it's going to be like in a few years when we actually have numerous stresses. So any tips, anything you think we could perhaps work on to improve our mental health? I would love to hear it from you. Thank you so much.
Yeah, absolutely. It's a great question. And I think stress starts so early in our careers, even in high school. And it's how do you get into college and medical school? And so I think the phrase, it's not a sprint, it's a marathon, it's maybe a little bit trite, but you can't put all your energy in, at an early point in your career, because as you said, you'll get burned out and not have it for the rest of your career. So there's a few things. I mean, one huge thing is having a close network of friends and peers in your medical school. I think for me, that was a major factor that contributed to fighting burnout as a medical student, because it's so stressful. You have to have people that understand exactly where you're coming from. I think it's great to talk to friends who are in other professions, friends from earlier in your life, absolutely, but no one's going to understand quite what you're going through, like somebody who's going through it exactly at the same time in the same place. So I think having that close network within either your medical school, or now there's online opportunities. So any medical student, any place, across the world can identify with these struggles. So I think that these social networks of your peers are really important, just as a, space to vent, even if it's just a complaining fest day. I think that really helps get some of that tension out. And, maybe you're going through a hard time and somebody else can say, oh, yes, something really similar happened to me last month. Here's what I did. And you can get all different kind of insights and opinions and support and feel like you are part of this family. So I think that social connection is really, really important. And I think the other thing is mentors. I always, tell my mentees and trainees that I advise that you don't just need a clinical mentor or a research mentor. You also need a work-life balance mentor. You need somebody who's been through this, who's a few years older, if not, 10, 20 years old, you can say, look, here are the things that you really need to focus on right now. Here are the things that can, wait a month, wait 6 months, wait a year, or maybe you don't need to do them at all to be successful. So I think having somebody who can mentor you specifically on work-life balance and wellness is really important. And that's so kind of having this mentorship team where it's not one mentor does everything.
Thank you so much, Dr. Marshall. And I will keep that in mind, and I will make sure and do my best to incorporate this. So thank you so much again.
I'll be asking the next question. I'm so glad that you mentioned mentorships. I know that you mentee like multiple students, and I'm very early in my career as well too. I'm still an undergraduate actually at Harvard. My concentration's in biology, and so I actually wanted to ask you, as a mentor yourself and as you were moving on in your career, like how have mentorships helped you specifically in your career, and what do you recommend for students who are in different stages of training, how they can find a mentor?
Yeah, absolutely. So I think for me, mentors have been everything, to the point where I actually chose my specialty because as a Harvard College student, the first interaction I had with somebody in medicine, without any doctors in my family, had no experience. And the first interaction I had happened to be an amazing mentor. And because of the work that I did with him, I was inspired to go into hematology and oncology. And so I think, throughout my journey, it's been, mentors have been everything. I think that, it was only maybe 5 or 10 years later that I realized that, somebody who's a mentor is not just somebody I look up to. I used to think it was like, I think I just want to be them. And so my advice is, again, it's not somebody that you want their exact career. It's like, I like this aspect of your career. And that helps you find mentors as well, because you're never going to find somebody who like, I want their clinical career and I want their life outside of the hospital and I want to do kind of the activities that, no, you're never going to find somebody like that. But if you find anybody that inspires you in any domain, you can approach them and say, Dr. X, I really like how you talk to this patient in clinic. Would you consider being a mentor to me for kind of physician-patient interactions? I'd only ask to meet with you maybe once every 3 months, and I just want you to take a look at how I'm interacting with patients for 5 minutes and give me some feedback. And that's going to be a very specific way of asking them, and also, very time-limited way. So they're much more willing to give that amount of time when it's a very specific type of mentorship. And you never know, the more time you spend with somebody over the course, of the next couple of years, they may actually take more of an active role as a mentor for you. But at the beginning, I think approaching people for almost like a mentorship project rather than a long-term mentor, because I think mentor, when you ask somebody, can you be my mentor? It sounds like this big, big thing where it's going to be like hours every week, working together. And I think instead, if you can say, can you be my mentor on X? And I'd like to meet once every X months, to do this. It's a very kind of specific task. And, they may not have time for it. That's always possible. But I think if you say just, to do this one thing every couple of months, or, hey, Dr. Y, I really like the fact that you're able to attend your children's soccer games on time, every day after clinic. Can you help give me some suggestions about how I can balance work and life better? And maybe that conversation turns into a more long-term mentorship. Not every mentorship relationship starts with a, can you be my mentor question? It can actually start with just, can you give me some advice on this? And then at the end of that, you could say, that's such great advice. Would you be open to talking, every 6 months about work-life balance? And that person can become kind of your work-life mentor.
That's so great. That's awesome. Thank you. Yeah, no, you're right. Just like not being afraid to approach them and take that initiative, and also kind of going and already being respectful of their time, because I think that those are really great. Thank you so much.
Thank you so much, Doctor. And, there's another question that I had that I find really interesting, because you spoke a little bit about burnout and you spoke a little bit about different workplace stressors as well. And, there's definitely no one size fits all approach for everything as well. So how do you believe that there can be a balance, especially for women, in terms of career demands, family responsibilities, as well as personal wellness to avoid this whole situation and, just maintain a good enough mental health and physical health, of course.
Yeah, I think you hit on it in the end. It's good enough. I think right now, our culture of medicine, there's very few places that, somebody could be, whether male or female, and say, my work-life balance is amazing. I'm never burned out. But if you can just achieve that, I don't often feel, exhausted from my work. That's how the burnout, like the scales that measure burnout actually work is, do you feel like this, once a year, once a month? That's not burnout necessarily. Do you feel like this once a week, several times? That's more burnout. So I think, and workplaces change over time. You have different obligations in your workplace over time. I think that it's looking for, a place where you have good colleagues that are supportive, that if they get sick or have something that you need to do, they're more than willing to cover for you. It's someplace that you will be able to find mentors. I think finding a first job, that's a whole nother talk in and of itself. But, there are questions when you're looking at jobs or residency programs or fellowship training programs that you can ask, like, how was it like finding a mentor here? Do you find that there's a lot of supportive faculty, in your career? How, much are you able to spend time with your family? It's not asking directly the question of, are you burnt out and do you have good or poor work-life balance? But I think these questions of, how often are you able to spend time with your family, or do you have hobbies outside of work? And if somebody is saying things like, well, I have no time outside of work, I don't have any hobbies, that's very telling. Versus the person who said, oh yeah, I love painting and I cook with my kids every day. So I think just asking the questions is a great place to start. And no matter how prestigious the institution is, if you're getting answers that are leading you to think there is not a very good quality of life, that may not be the best choice, at a given point in your career.
I definitely agree, because these are some different situations. And like you had also mentioned that everyone's going to be very different and everyone's patterns and work styles definitely going to vary. So yeah, I definitely agree with what you said. Thank you.
And for the last question, I'll be asking, for our more junior attendees just getting into research and medicine, what inspired you to pursue the field of hematology and oncology? How has this choice impacted your life? Has it been everything that you've initially anticipated?
That's a little bit much, I think, for me to answer in the time that we have left. I will say that, initially, I'm a big believer in gender equity and women's health. And it was a combination of that and my amazing mentor who was an oncologist, back when I was a college student, that drew me. I thought I was going to be a breast cancer doctor. And then when I got to fellowship, I realized that I actually really like practicing in the inpatient setting and working with kind of acute conditions like clotting and bleeding. And so that's what led me to hematology, specifically my focus on thrombosis and hemostasis. And so my interests kind of all interwove together with the women's health. And so I now do women's thrombosis and hemostasis, amongst, the broader consultative inpatient work that I do. But my real love is women's thrombosis and hemostasis. So I think over the course of your career, you're able to kind of get a little bit specific about your interests and allow them to fuse in a way that ideally can create a career path that's right for you.
Thank you very much, Dr. Marshall, for taking the time for today. And yeah, I just want to say thank you. And especially, I know all our women here that are in attendance, I know we really appreciate your insight. You are, truly an inspiration. So thank you again for your time.
Oh, thank you so much for the invitation. And I hope this is helpful for anyone who's going to be listening.